So my name is Niki Zacharias Millward, and I am an associate professor at MD Anderson Cancer Center in the Department of Urology, and I'm focused on urological cancers and specifically kidney cancer. So my lab had a chromophobe renal cell carcinoma grant. We are specifically interested in looking at metabolism and how metabolism is different in chromophobe RCC versus other kidney cancer subtypes like clear cell RCC. Chromophobe RCC is characterized by an abundance of abnormal mitochondria. So therefore we think that it has to change its metabolism so it can survive and proliferate. So we want to understand that, and we want to see if we can use metabolic inhibitors to inhibit chromophobe RCC growth. We're also interested, so chromophobe RCC is a very interesting kidney cancer, and specifically because for most patients they have an indolent form of chromophobe RCC. So after the tumor is resected, the patient is cured. But unfortunately, for a subset of patients, they get metastatic chromophobe RCC. And we're very interested in trying to understand the differences between those patients that have indolent disease versus patients that have metastatic chromophobe RCC. Because unfortunately, we don't have the therapeutics that we use, for instance, for clear cell RCC, like sunitinib or immune checkpoint blockade, don't work on metastatic chromophobe RCC. So we're very interested in trying to understand what's that difference, and can we find, and we think that might be metabolism, a therapeutic specifically for metastatic chromophobe RCC. So I'll say one thing that is great about the Kidney Cancer Association is it really allows us to look at these rare subtypes and allows us to look at sort of a small population, right, of people. Like I said, there's really only a small population that get metastatic chromophobe RCC. So it's very often hard to find grant funding for something that is a very small population. And what's great about the Kidney Cancer Association is it allows us to really study chromophobe RCC, which would be hard to do if we were looking for, let's say, NIH funding. So I'm research faculty at MD Anderson, so I really run a translational lab and run a preclinical lab where we're looking at animal models. And how I got interested in chromophobe RCC is I have really close collaborations with physicians at MD Anderson, like Dr. Tanier, Dr. Masoul, and also with the urologists that are at our institution, like Dr. Karam and Dr. Mateen. Based on their conversations with them, I realized that chromophobe RCC, and specifically metastatic chromophobe RCC, behaves very differently than clear cell RCC. So that's how we sort of got interested in really trying to understand the cancer biology between chromophobe RCC and how it behaves differently than clear cell RCC. I definitely believe that, even for research scientists like myself and research faculty, that we should engage with patient advocacy groups like the Kidney Cancer Association. I know that it's really helped my research, helped my understanding, because these patient advocacy groups are great at bringing together patients, patient advocates, physicians, researchers, all together in one place with one thing in mind. For, in our case, right, thinking about kidney cancer and how can we eliminate kidney cancer. And it really allows us to learn from each other and think of new ideas and what we could do. It allows us to find collaborators. It allows us to think as a group, compared to, like, if you went to a very large conference where all cancers are being talked about, then you really get lost a little bit. But this really allows us to focus on one area. I also think it gives you an opportunity to know what grant mechanisms are out there specifically to kidney cancer or whatever cancer you're looking at. So one of the things that I would say that's exciting about studying rare cancers and rare kidney cancers, and this again sort of comes a little bit from my own experience being at MD Anderson Cancer Center, where we have close collaborations with our physicians. In many cases, these patients have no other, they're after chemotherapy doesn't work, they have very few options. So what I've really enjoyed being in the rare kidney cancer space is that we can easily, in some cases, translate some of what we find directly into the clinic. So in fact, I'm giving a poster today on renal medullary carcinoma and panitumumab, which is an EGFR inhibitor, monoclonal antibody against EGFR, that's already now being used with patients with renal medullary carcinoma that are not responsive to chemotherapy any longer. So it's very exciting to be in this close collaboration with physicians and see what you're doing, all this work you're doing in the lab, being used in patients and seeing good results. It's extremely exciting.